Managing Director here, Dave McHendry. I'm not sure if you're aware, but KP are doing a huge piece of work at the minute with the FA and funding partners shaping local delivery football plans. So there's some information in your bags around that sort of stuff. Dave's going to be sharing sort of their insight from KKP around how to do really effective co-location for the masses. It's easy to just kind of throw everything together in a building, but how do you actually get that working really effectively? And also the work that they're doing to support local authorities to engage a more collaborative approach. So, Dave, over to you.
Thank you. I suppose if we start with what has been the driver for co-location, and I think direct quote from Towards an Active Nation was really identifying how actually make it easy for people to participate regularly, and actually that some of the key increases in activity levels have been where there has been co-location of services, and I think that's a really important driver. So that's both led the sector and been informed by those organisations that have really been innovative at the early stages. There's lots of examples, and we've seen many examples of good co-location elsewhere up and down the country. There's an example from Blackpool. You've got a library, leisure centre, health centre as part of that. There are key examples elsewhere up and down the country. We're currently doing a scheme in Chiltern, which includes community centre, library, and preschool nursery. But actually, I suppose one of the challenges we have is, do we really have co-location, or do we just have back-to-back services? And in many instances, when we're doing facilities planning work and we're going to local authorities up and down the country, what we're actually seeing is back-to-back services. We're not seeing true co-location. And actually, from our perspective, co-location really works where services are engaged. They understand what their neighbours' requirements are, their beliefs, and they can develop really clear objectives. And they can really target resources to deliver for specific communities and to deliver specific outcomes. But what we're seeing is that there's too many examples of, you've got a great swimming pool fitness facility alongside a health centre, and actually they don't work together, they don't collaborate, they don't do joint initiatives. And actually, co-location is the exception. We've got a multitude of generations to go before we replace existing facilities that are standalone, that have got a real challenge, that in some cases there won't be opportunities for co-location. So it's actually, the challenge is here and now, not waiting until we have co-located facilities to try and deliver these wider outcomes. So I suppose the challenge is, how can we really take the principles of co-location? And from our perspective, that really requires strong leadership, not just within the local authority and the strategic partners involved in that facility, but actually from our leaders in terms of making sure that there are certain things on the case there that are really important to drive the outcomes that we're looking to deliver. And actually, there's a real need to engage in prevention, and a key driver for that is physical activity. What we're seeing is that actually everyone knows physical activity is a key driver, but actually not a lot of stakeholders and partners are actually coming to the table with that as a solution. And actually, we need to be bothered. Facility operators need to be bothered about the inactive. So from my perspective, we'd like to sort of introduce the concept of health checks. And actually, we're going to use Northampton Leisure Trust as an example of that. So if you're not aware of it, when you're 45, you're entitled and invited along to an NHS health check. So that checks your level of risk in terms of heart disease, diabetes, etc. Throughout 2015 to 2018, 15 million people were eligible for a health check. 7.5 million were invited. Doesn't mean 7.5 million took up the offer. They were invited. Now, I don't know whether that's a good hit rate or a not so good hit rate, but actually, there's a market of inactivity out there that actually we should be potentially capitalising on. So this is the NHS health check process. So if you are coming through the process, if you're reasonably active, reasonably fit, no underlying process, you know, they check your cholesterol levels, blood pressure, height, weight, usual. And then, if appropriate, they identify physical activity interventions, weight management services. If you need a clinical assessment, which actually is a bit more detailed, then they refer you back to the clinician. But again, there's an output in terms of lifestyle advice, physical activity, signposting into referral programs. Personal experience, I went to a converted bus. It was in the surgery car park. It done out of our service. Now I'm a prime example and a prime candidate for increased physical activity. Carrying a bit too much timber, I should be referred. There was no signposting, there was no nothing. There wasn't even a leaflet. I live in Warrington. Charles showed two examples of Great Sankey and Orford Jubilee as key examples of good co-located facilities. They weren't connected into my health check. I had no signposting into any physical activity offer as part of that. And unfortunately, that seems to be the process up and down the country. We're not getting those opportunities. We're not maximising those opportunities. So we'd like to introduce you and use Northampton Leisure Trust as a case study. They've worked with their GP Alliance, and one of their GP surgeries was failing in terms of its hit rate for health checks. The GP made the initial contact with the patient, and the patient contacted the trust to arrange their health check. They also undertook opportunistic health checks, so they actually promoted it through their programs. So their Young at Heart programs, their other bookings at the centre, their members. Because actually a lot of them came from the same part of town. So they delivered an increased number of health checks over that short-term period, which really got the GP surgery out of the proverbial. So it was a key requirement. But actually it took them 9 to 12 months to really stamp their credibility and earn the trust and respect of those health partners as part of that. What they're doing now, they're now in a 5-year contract with the GP surgeries across the piece. They will have access to potentially 60,000 residents who will be invited for a health check. Now actually, any business, any leisure trust, a private operator of community leisure facilities who would have access to that market is really quite substantial. So from a business perspective, it's good practice. Actually, that's led to them actually developing an activity referral lead, recruiting staff to actually deliver their health checks. And actually, they're now delivering it from 3 of the 4 centres, not just 1. So actually, they're able to give a cross-sector, cross-borough access to that service, out of hours, weekends, evenings, that actually a lot of doctor surgeries aren't able to provide. The biggest challenge is actually engaging with patients. The trust is not quite trusted enough to have direct access to those patients. So they still need to go through a process of the GP contacting the patients then making contact with the trust as the operator of that scheme, and then the GP chasing up non-responses. But actually there's a key driver there in terms of have an opportunity to access multiple thousands of potential clients over the next 5 years that could then improve their business. And actually, they're also looking at that, of taking that into the business environment. So they're not just doing it within their centres, they're actually going to main employers within the area and targeting them to actually to deliver in the employment base. But actually, they get paid for that. So they're paid for the delivery of that scheme. But actually, as a business, there's a real opportunity to engage with future clients, to actually to refer them back into their physical activity programs or to look at that as members. So they have a real opportunity to signpost people into their existing programs. And they've had to increase those programs to accommodate just the recent demand created from that scheme. But actually, as I said, there's potential significant commercial benefit of that. So I suppose the challenge, are we really maximising co-location opportunities? We always get thrown up the whole issue of data protection, GDPR, and it's a nightmare. But actually, we need to get over that and work with partners to ensure that we look at ways around that access and to really develop those opportunities. Co-location is currently the exception rather than the rule. There's lots of facilities out there that have no element of co-location, that operators are still ploughing their own furrow and actually not looking beyond the four walls of the building. So actually, we have a real opportunity to signpost health check patients into physical activity programs. And actually, from a sport and leisure perspective, that should be a requirement of health. Someone should be banging on the door to make sure that in every health check scheme, there is some sort of signposting, because it's not actually happening. So, because we can't drive, we can't get the inactive active unless we can get access to them. And there's a real challenge there for the sector. So just some closing thoughts. I think we'd all agree co-location is a real positive tool in extending the reach of facilities, but it can be much more effective at delivering our outcomes that we require in terms of getting the inactive active. The same outcomes can be actually delivered without co-location. The example of Northampton Leisure Trust, there's not a co-located facility in sight. They're all independent, non-co-located facilities. It's just that they've been bothered to actually get into this program with health to then deliver those outcomes. So, and really, that's the key driver, is we need to be bothered. From my perspective, co-location, it's not a building, it's a philosophy on how we operate those services. And we need to look at that, because actually, if we are building facilities for the next 25 years, we really need them to drive those outcomes and drive the opportunities to really get the inactive active. So, thank you.